You're listening to Medscape's In Discussion series on respiratory syncytial virus in adults, a podcast where thought leaders and clinical experts share their diverse insights and practical ideas for optimizing patient care. This series is hosted by Dr. Forrest Arnold. Dr. Arnold is the chief of the University of Louisville Division of Infectious Diseases and director of the Center of Excellence for Research in Infectious Diseases. He also acts as the co-editor-in-chief for the Journal of Respiratory Infections and program director for the Clinical Fellowship in Infectious Diseases. Relevant disclosures can be found with the episode show notes on Medscape.com or the Medscape app. The topics and discussions are planned, produced, and reviewed independently of advertisers. This podcast is intended only for U.S. healthcare professionals.
Hello, I am Dr. Forrest Arnold. Welcome to Season 2 of the Medscape In Discussion podcast series on RSV in adults. Today we'll discuss preventing RSV outbreaks within healthcare facilities and strategies to minimize transmission of RSV among healthcare workers and patients during an outbreak. First, let me introduce my guest, Dr. Hannah Nam, Assistant Professor of Medicine at UC Irvine and Director of Transplant and Immunocompromised Hosts Infectious Diseases. Welcome to the Medscape In Discussion podcast.
Thank you so much for inviting me here to talk about my favorite topic.
Great. The aim of today's podcast will be to go over two themes: to provide strategies for healthcare professionals to prevent RSV outbreaks and to manage active RSV outbreaks. On a scale of 1 to 10, how big of an issue is RSV in healthcare facilities, you think?
I think it's very underappreciated in terms of its impact. I would say 10 from me, since RSV is my research area and my favorite topic to talk about.
Excellent. What is the impact of RSV on healthcare facilities, their patients, and healthcare workers?
RSV is an interesting infection in that it really tends to affect the most vulnerable in our population. So the risk factors for developing really bad disease when you get RSV tend to be anyone with older age. And then, of course, this is compounded whenever you have any extra comorbidities, such as chronic heart disease or lung disease or weakened immune systems, or with any issues with frailty or mobility. And of course, these are the patients that we're talking about today, those patients that are in healthcare facilities. So just for example, if you look at kind of the year of 22-23, where we had a huge RSV outbreak, the CDC-based RSV Net actually put out data showing that out of all of those who were over 60 and hospitalized with RSV, about 17% of them were those who were in long-term care facilities. So RSV actually tends to be a pretty big issue in those residing in long-term care facilities, but I don't think it gets the proportional attention that it deserves.
Right. So I think that's one of the areas that you mentioned that it's underappreciated because we have such a high hospitalization rate. So there's frequency and severity. It's communicative. Could you discuss the key infection control measures for healthcare professionals to implement?
Some of the things to understand with measures to implement with RSV also go back to how it gets transmitted. We've heard a lot about different isolation methods as well as different methods we can implement with COVID, and then we've also been very familiar with these methods with influenza. RSV is actually a little bit different than these two viruses in how it transmits. RSV is a little bit of a larger virus than both of these, about double the size of flu and COVID. And how it does transmit is actually not primarily through aerosolization or coughing. Of course, some of those methods contribute to the transmission, but actually because it's such a large droplet, it tends to fall and then sit on surfaces. And it can actually live on hard surfaces such as doorknobs for many, many, many hours. The primary mode of transmission for RSV actually tends to be contact, which is why you'll actually see isolation guidelines that incorporate contact as well as standard precautions, plus or minus the droplet component. This actually means that for healthcare workers to prevent transmitting RSV, one of the more important methods is to ensure that they're performing good hand hygiene, as well as making sure that all surfaces that the patient is touching be sterilized very well. Because, for example, the patient just touching doorknobs or table surfaces after touching their face can really transmit the virus pretty effectively on these surfaces. and then healthcare workers coming and touching these surfaces, environmental workers as well, to help clean the areas can actually get the virus transmitted pretty effectively for healthcare workers. So yeah, hand washing, contact precautions are actually much more important for RSV than the other respiratory viruses.
Thank you for that. That is an area that it's not underappreciated. It's just not known. I don't think that because it's a larger molecule, we have a different mode of communication, and that's contact versus the aerosolization. In your opinion, what are the most effective infection control measures to prevent RSV outbreaks? I can only imagine it's going to be based on what you just said. The contact plays heavy into this.
I think with any effective management strategy for infections in general, there usually have to be several components implemented at the same time. And I think the key concepts basically for any outbreak, including RSV, are going to be to identify the virus as well as isolating and then informing all parties that are involved here. So identifying includes facilities being aware of any viruses that are circulating in the community at the moment. Especially with RSV, it tends to go kind of hand in hand with influenza and for the past couple years with COVID as well. So facilities being aware of the community circulation and then educating all staff, for example, including housekeeping and dietary, any staff that interact with your residents. So after identifying the virus flow in the community, I think all facilities should be aware of increasing surveillance for that virus in general. And because increasing surveillance helps monitor for any increase in cases in residents and staff, it's really important that facilities are doing this. And then what's also not done as well, but is really important, is identifying the pathogen. We have a lot of rapid tests for influenza as well as COVID that have been done. A lot of facilities have switched to using kind of triplicate multiplexes, influenza, RSV, and COVID all together. But identifying RSV, I think, is really important here because the PPE that you're going to use is completely different from COVID and influenza in the sense that you're going to have a much more higher focus on the contact precaution.
You mentioned a contrast to influenza and COVID earlier with RSV. And so with those other two viruses, healthcare workers usually get vaccinated, and so do patients. But with RSV, only patients get vaccinated. And will that have an impact on the RSV outbreaks in facilities when we look forward?
That's a really interesting question in that I don't think we necessarily know how well the RSV vaccine works in preventing transmission because all of the studies that were done with RSV have been done in patients who are going to be impacted by the RSV. And all of the studies have basically been powered to show the decrease in symptoms with RSV. I do think that's going to be an area that's important for research. What we do know extrapolated from the other viruses is that vaccination has been an important strategy for healthcare workers to prevent transmission. So I do imagine that it will be similar for RSV. Just don't have great data to say that RSV vaccination is essential for healthcare workers in preventing transmission. On the flip side for that, you mentioned that RSV vaccination for patients prevent infection in patients, which is very true. What we still have to work on a lot is vaccinating the patients to begin with, because if you look at recent data for vaccine uptake for RSV, I think it shows that only about 20% of eligible adults have actually received the vaccine to begin with.
We give, again, contrasting to say influenza, we give influenza vaccine, and then we've seen in studies that patients that end up getting influenza will have a less severe disease when they do actually get it because they've been vaccinated. Do we expect that with RSV as well?
Yeah, actually, the RSV vaccine was looked at in terms of how well it decreases symptoms in patients over 60 years old. So there are two separate vaccines that have been approved last year that we're talking about. One of them is an adjuvanted vaccine, and that has been effective at decreasing lower respiratory tract symptoms for patients over 60 in about 80% within the first RSV season. And then if you look at 2 seasons total, 2 years total aggregate, it's about 75% effective. the contrasting vaccine, which also was looked at in patients over 60 years old, and they showed that it was pretty effective in decreasing symptomatic infection with lower respiratory tract disease at about 89%. And then if you look at 2 seasons, it was still about 85% effective. So the vaccine is pretty effective in decreasing symptoms over at least 2 years, which is how much data we have.
Great. Sounds like the RSV vaccine is mainly to prevent RSV in whoever is immunized and only indirectly prevents transmission of the virus because it's obviously hard to spread it if you don't have it in the first place. Both very good reasons to get the vaccine in the first place to prevent our vulnerable populations from getting it. 2 other things that we've discussed so far that are important is that RSV affects the most vulnerable populations, older adults, those with comorbidities, those who are frail and have mobility issues, and that we appreciate RSV is different than influenza or COVID, especially in the molecular size, making it not airborne as much as it is transmitted through contact. So let's move on to talking about outbreaks. Could you provide an overview of effective management strategies during RSV outbreaks for minimizing RSV transmission among healthcare workers and patients?
I think a lot of the strategies that work for outbreak management tend to be multi-component and multifactorial. I think the first is, again, identifying that the pathogen you're dealing with is RSV to begin with. So testing early and then knowing that you have RSV is really important. And this is especially important because RSV tends to co-circulate again with influenza and then with COVID as well over the past couple years. And if you just look at symptoms, they're completely indistinguishable. You can't tell whether you have RSV or flu or COVID just by symptoms. So knowing that you're dealing with RSV to begin with, I think is the most important. And then the other things that are really important are understanding what resources that you have and allocating those resources appropriately. So understanding what kind of personal protective equipment you have, how much hand hygiene supplies you have, like gloves, etc. And then the other component is making sure that everyone is educated regarding RSV. So this includes the patient themselves, but also visitors as well as healthcare workers on what RSV is, how it transmits, especially through contact, and making sure that hand hygiene is really emphasized. And then monitoring patients, because even one patient with RSV in a large facility, especially in grouped or long-term care facilities, can potentially mean that you're going to have other patients with RSV, especially if they were using common areas or sharing a room with other patients. So monitoring other patients as well as the healthcare workers taking care of the patients are really important. And then, unfortunately, there's no good treatment for RSV or what we call chemoprophylaxis, or basically giving patients medications to prevent RSV spread. There's no good treatment for it, but there's a lot of supportive care that we can offer for the patients. So making sure that they have those appropriate treatments and then watching for symptoms, making sure they don't get worse. I think all of those are very important strategies to use together.
You mentioned healthcare workers and patients being educated, and you also mentioned visitors, which I think is a group of people who are sometimes neglected, because I'll see nurses and doctors washing their hands and wearing the proper isolation, and of course patients doing our protocols when we take the patient maybe to radiology. But visitors, sometimes I'll walk in and it's like they've ignored every sign on the door. So are they an exception or not?
No, of course. Educating the visitors, I think, is really, really important, especially because it's really easy, for visitors to bring in RSV unknowingly to their loved ones while they're seeing them, but also because it's very easy for them to carry it out. And if the visitors are also using common areas where the patients or other patients congregate, then it's potentially a source of transmission. So yeah, I think it's very important that the loved ones also know what infection their loved one has, as well as how to prevent it from spreading.
Exactly. We tend to selfishly want to protect ourselves, but we can bring our patients, and visitors can bring their loved ones RSV unknowingly. So then they've got whatever ailment they came to the hospital with, whether it's a heart attack or pneumonia, and now they've got RSV on top of it. It's a catastrophe when that happens, especially because they're already sick and they'll probably respond worse than if they had been in their usual state of health prior to getting RSV.
That's exactly it. I completely agree. We know with RSV that the more comorbidities you have, the more underlying issues you have, the worse the illness and the outcomes tend to be. So completely agree with you there.
What about isolation protocols? Do you have a comment about those?
So isolation protocols, I think twofold. One is in the setting of an outbreak. So if you know that the patient potentially has RSV, the best isolation protocol, if resources provide, is to move that patient into a single person room and then hopefully minimize the risk of transmission to other roommates as well. And the isolation protocols that are recommended by the CDC are actually standard and contact, and then plus or minus droplet, depending on the facility that you're at. But if you have a facility that really doesn't have the resources to place the patient in a single room, the recommendation is actually just to not move them and not place them in a new room with a new resident, unless you know that the other resident also has confirmed RSV. The other things that you can do if you're not able to isolate the patient into a single room actually is potentially considering placing the beds further apart, like at least 3 feet of separation between the two beds, as well as making sure that both of the patients are not sharing any resources, so not sharing any table surfaces or any common resources if possible, until you know that the roommate is also safe as well.
Right. So if you have a large population who has RSV, cohorting should be something that facilities consider doing.
I do think that based on their illnesses is something that you should definitely consider doing, especially if you know that everyone has RSV for sure. So that's where the testing and then knowing that they have RSV, the diagnosis is really important. And then the only other thing I'll mention is that when you do test for RSV, it's really important to know that they're negative for influenza or COVID as well, because we have seen co-infections with these viruses too.
Okay. And then with COVID, we had a lot of talk about asymptomatic carriers. Is that an issue with RSV?
Absolutely, yes. What we do know is that with RSV, the symptoms start to show up about day 4 to 6 after you get infected. So it's actually several days after you've been exposed that you start to show symptoms. And patients can actually be contagious for a day or two, even before they start to show signs of illness. So yes, unfortunately, asymptomatic transmission is a problem with RSV. And then the other group of patients that can be transmitting the infection asymptomatically are those with severe immunocompromise, because we know that they can actually shed the virus for somewhere up to 4 weeks, actually, and it can be transmitted with that shedding after they've actually recovered from their symptoms as well.
Okay. To summarize this second treatment of outbreaks, you mentioned that we have to identify the pathogen. That's very important. We have to understand our own resources when we're in a facility. And then we're going to end up applying multifactorial strategies all at the same time. So it's also important to have healthcare workers, patients, and visitors educated about RSV even before they come to the patient's bedside. And this will help diminish transmission and help with preventing RSV from entering facilities as well. Today, we've talked to Dr. Nam about RSV in adults and preventing RSV outbreaks within healthcare facilities and strategies to minimize transmission of RSV among healthcare workers and patients during an outbreak. Thank you for tuning in. Please take a moment to download the Medscape app to listen and subscribe to this podcast series on RSV in adults. This is Dr. Arnold for the Medscape In Discussion podcast.
Thanks for listening to Medscape's In Discussion Respiratory Syncytial Virus in Adults podcast series with our host, Dr. Forrest Arnold. Be sure to look for more In Discussion episodes wherever you get your podcasts. Check out Medscape.com or the Medscape app for show notes, links, and more information on respiratory syncytial virus in adults.